is it same day or are they different days? So again, you can go back and look at that other one, and we talked about the simultaneous or the sequential nature, right? And so the same day activity of using both of these, let me take a step back too. So when we first started seeing, the literature on combined types of physical agents, it was pretty limited, especially using some of these low power. So I quote often a study that they evaluated the individual or the combined of laser, and it was low power laser, e-stim, or therapeutic ultrasound. So each one individually and then each one combined, right? And they essentially found no difference. And if you don't understand, what that actually means in the nature of patient care, it's like, well, the e-stim took 20 minutes. The ultrasound protocol took 8 minutes, but the laser took 90 seconds. So even if it was a wash, well, why would I want to choose laser? And the reason was because if it was just as effective, but it only took me 30 to 90 seconds, and that was again for that minute little area, a low-powered laser, then that's part of your choice options, right? So same day appropriate when the tolerance is predictable. What do I mean by that? It means that I have a certain expectation of what their discomfort level is going to be when I'm applying radial pressure shockwave and the potential side effects of laser or shockwave. And so when we know what that's going to be, and really it should be very minimal, by the way, right? If we induce increased edema formation, lots of petechiae, you probably overdid it. And I'll still have people argue and say, well, that's what's working. It's like, well, if you've ever tried less, you might actually find it will work a little bit less. So during these phases, we're still seeing in the literature typically one time a week, especially if you're going to be aggressive on the shock wave. But where laser can still come in and its potential benefits, especially during those times of higher irritability, is it can help facilitate those biochemical changes, right? That's where it tends to be really important and can potentially elevate, as we talked about in the previous webinar, as the literature showed us. Split day. Well, the split day is if one, we're not trying to introduce too much energy, or we're actually trying to facilitate a recovery from that particular therapy where we're not doing them on the same day. I will throw out the other thing too is how you manage your time and the typical, duration of a patient visit, and sort of your model. Like how many things can you do to a patient within a single session is also something that you're probably going to want to take into consideration. Yes, and I think Josh just posted that. You can put if you have questions. We'll have time at the end here to go through some questions if you have them. Okay. So irritable start. I'll use the example of that low back pain patient. The low back pain patient comes in. It's an acute exacerbation of their chronic condition. So that's an irritable start. So we probably would also classify really any acute type of injury in there. And so in that irritable start phase, again, laser's so good biochemically without creating discomfort to the patient. So toleration is typically, very, very high, right? So oftentimes I won't even start with shockwave until we get past that phase. And that's often going to be 1 to 2 weeks, right? So we've been able to manage that inflammatory state, and create that rapport with the patient. So the first 2 weeks, I may not be doing any shockwave. Now, is that always? No, because some people are going to be a little bit more tolerable than others. And frankly, I want to get to shockwave as quickly as possible because it's a time frame and I want to get people better as quickly as possible. And if you again consider your management profile within your clinic, if you're classic, 12 visits, we want to make the best out of however many visits that we possibly have, right? And so once I hit typically that third week, that's when I will start doing the shockwave. I always do a wean off on the laser. And so the benefit of that is sort of understanding what people will do at home. I call that the Zumba effect, and I probably tell this story every single time I present. But you know, patient feels better when they leave. They come in the next time. Oh man, I don't think this is working. Really, well, I don't understand what happened because you're doing great. Yeah, I didn't do anything. I went to Zumba when I got home, and it's like, well, you weren't supposed to do that, right? Because that was a load tolerance effect that they were not ready for yet. So laser allows us to sort of taper off, right? Laser is also really good at pain. So if they still are in those stages of pain, it tends to work well. So the other reason for the taper with laser and then the increase in the shock wave is the patient psychology of it. They need to see changes. If you're doing the same thing every single time, day in and day out, just like I told you about my barber, that can be problematic for some people, right? And so this actually shows changes when we stop doing something and then we start doing something else. And I'm going to talk about this in the documentation of even just shockwave in a moment here, but also I let people know like what it is that we're doing. So when I make changes to some of the parameters, I'm even gonna let them know, and I'll talk about that in a second. Now to the interface, right? So this is the type of tissue we're beyond that biochemical stage, and this is where again I'm going to go into shockwave. And so typically my pattern is going to be once a week. If I'm less aggressive, especially during some of these earlier stages, we can get into twice a week. A lot of that comes from the erectile dysfunction literature. So the reason that that literature is really, really good is it's very well controlled. Um, and so what they found was you could get increased benefit doing it 2 times a week. But is it that much different or is it that much better for you? So you have to be less aggressive. And I don't mean just in the erectile dysfunction, but really any part of the body because you don't want to create an inflammatory response, right? And this is also where laser comes into play because you are in danger of doing that. And again, it depends on the patient, and this is where it could be 0 or 1 time a week, typically matched with the day that we're actually doing shockwave. And then those that seem to be the tweener, right? They're sensitive. Maybe we're making some changes. Maybe you added exercise therapy, which uh, can induce some increased soreness, especially if they're doing high intensity stretching and things like that. We want to, again, use that potentially as an anchor, and you need to segregate or separate that from a flare up, right? In other words, delayed onset muscle soreness is going to be different than what we would see in terms of a flare up where there was an inflammatory stage that kicked.